Hello and welcome back to another episode of In the Mind of Me. I haven't done one in a while, for several reasons. One being a bit busy sorting things out. Two, I felt I was like boring everyone. They weren't very like structured. My videos weren't that structured at all, and often I would end up starting to record something and forget what it was even I was even going to talk about. So because I tend to get the best ideas like when I'm trying to go to sleep when my mind's trying to unwind. But I never write these things down. So I've now actually started writing them down. I've actually already got like four or so ideas of like things to talk about and whatnot. Um, but yeah, so before I bore you, this one's about anxiety and well, this is more answering a question really. What is anxiety? I found a rather good piece of like information on the internet, and yeah, the question is literally what is anxiety. So I'll just because I suffer from anxiety myself, like in some cases quite severely. And I don't quite like at the same time I don't. I know I suffer from it, but I can't quite explain it. So that's also another reason what made me look this up and also gave me the idea to share this with you lot as well, my viewers, my fellow YouTubers. So yeah, right, yes, I am like quoting from medicalnewstoday.com. Info or /info /anxiety I can't actually see the rest. Um, so it's like it was the first site I went on, and it seems like a whole page of general stuff, I guess. Anyway, so I'll start reading. Um, Anxiety is a general term for several disorders that cause nervousness, fear, apprehension, and worry. These disorders affect how we feel and behave, and they can manifest real physical symptoms. Mild anxiety is vague and unsettling, while severe anxiety can be extremely debilitating, having a serious impact on daily life. People often experience a general state of worry or fear before confronting something challenging, such as a test, examination, recital, or interview. These feelings are easily justified and considered normal. Uh, Anxiety is considered a problem when symptoms interfere with a person's ability to sleep or otherwise function. Generally speaking, anxiety, no, Generally speaking, anxiety occurs when a reaction is out of proportion with what might normally be expected in a situation. Sorry if I'm going a bit fast here. Anyway, yeah, anxiety disorders can be classified into several more I always get this word specific types. The most common are briefly described below. Okay, so the first one is what is generalized anxiety disorder, or GAD for short. Generalized anxiety disorder, or GAD, is a chronic disorder characterized by excessive, long-lasting anxiety and worry about non-specific life events, objects, and situations. GAD sufferers often feel afraid and worry about health, money, family, work, or school, but they have trouble both identifying the specific fear and controlling the worries. Their fear is usually unrealistic or out of proportion with what may be expected in their situation. Sufferers expect failure and disaster to the point that it interferes with daily functions like work, school, social activities, and relationships. Yeah, it kind of even gives like a short little video, which I'm not sure if I can even like. No, it kind of. Anyway, next one is what is panic disorder? Panic disorder is a type of anxiety characterized by brief or sudden attacks of intense terror and apprehension that leads to shaking, confusion, dizziness, nausea, and difficulty breathing. Panic attacks tend to arise abruptly and peak after 10 minutes. And these are horrible. If you've never had one, I don't wish it upon you, or anyone that's for that matter. Anyway, difficulty breathing. Panic attacks tend to arise abruptly for that, but then they may last for hours. Panic disorders usually occur after frightening experience or prolonged stress, but they can be spontaneous as well. Uh, panic A panic attack may lead an individual to be acutely aware of any change in normal body functions, interpreting it as a life-threatening illness. Hypervigilance followed by hypochondriasis. Not quite sure what those two mean, if I'm honest. In addition, panic attacks lead a sufferer to expect future attacks, which may cause drastic behavioural changes in order to avoid these attacks, and that just could not be more true, at least for me anyway. Because when I have a panic attack, my jaw will like lock and go to the side, and then it goes further, and it's painful, really painful, and it totally changed my life pretty much. What is a phobia? A phobia is an irrational fear and avoidance of an object or situation. Phobias are different from generalized anxiety disorders because a phobia has a fear response identified with a specific cause. The fear may be acknowledged as irrational or unnecessary, but the person is still unable to control the anxiety that results. Like, for example, like spiders for me. Like, it can be a tiny little spider. I'm like, and it's still, I don't know, it's like crawling right above me. I have to like constantly be watching, like every other second or so. I'm like, just having to look up. Anyway, acknowledged as rational or unnecessary, but the person still unable to control the anxiety. Sorry, I lost myself in. The fear may be acknowledged as irrational or unnecessary, but the person is still unable to control the anxiety that results. Stimuli for phobia may be as varied as situations, animals, or everyday objects. For example, acrophobia even occurs when one avoids a place or situation. I think I might have said that wrong. Agoraphobia or something. I think it's acrophobia. Anyway, occurs, I can't even say that right. When one avoids a place or situation to avoid an anxiety or panic attack. Acrophobics will situate themselves so that escape will not be difficult or embarrassing, and they will change their behaviour to reduce anxiety about being able to escape. And that's all it says on that one. Okay, this is another one. What is social anxiety disorder? Social anxiety disorder is a type of social phobia characterized by fear of being negatively judged by others, or a fear of public embarrassment due to impulsive actions. And from already just reading this, I think this one is a fairly common one. Whether the person like knows or wants to admit or anything. Anyway, impulsive actions. This includes feelings such as a stage fright or fear of intimacy, and a fear of humiliation. This disorder can cause people to avoid public situations and human contact to the point that normal life is rendered impossible. And this one, even says here, gives a 20-minute video discussing social anxiety with leading expert. I'm not sure if I can actually say his name, but due to copyright, I might need to read up on the whole copyright thing, to be honest. Yeah, and this one I think is a fairly well-known one. What is obsessive-compulsive disorder? Obsessive-compulsive disorder, or OCD for short, is an anxiety disorder characterized by thoughts or actions that are repetitive, distressing, and intrusive. OCD sufferers usually know that their compulsions are unreasonable or irrational, but they serve to elevate their anxiety. Often, the logic of someone with OCD will appear superstitious, such as insistence in walking in a certain pattern. I wasn't doing that face because I thought that was weird. I was just like, yeah, how I said it, just like in my head it didn't make sense. But anyway, OCD sufferers may obsessively clean personal items or hands, or constantly check locks, stoves, or light switches. Fairly short one on that. I think maybe could have gone into a bit more detail, because although it's a fairly well known one, it's not, the ins and outs aren't, I wouldn't say, fully known. what's this one? Okay, this one's short for what it actually is. What is post-traumatic stress disorder, or PTSD for short? Post-traumatic stress disorder is anxiety that results from previous trauma such as military combat, rape, hostage situations, or a serious incident. PTSD often leads to flashbacks and behavioural changes in order to avoid certain stimuli. So for that, it's not. I haven't actually read this whole page, so to speak. I was. Yeah, sorry about that. This one I haven't heard of before. What is separation anxiety disorder? Separation anxiety disorder is characterized by high levels of anxiety when separated from a person or place that provides feeling of security or safety. Anyway, sometimes separation results in panic and is considered a disorder when the response is excessive or inappropriate. Yeah, that wasn't much even. Okay. Okay. It's on the next page here. What causes anxiety? Which was actually going to be a different video, to be honest. But if it loads, yeah, that'd be brilliant if it actually loads. Yeah, it loaded. Okay. So again, I haven't even read this page at all. I haven't even looked at it. I just saw. Okay. So anyway. Wait for it to finish loading. I keep realising I'm like going that way when the camera's like dead centre. So I keep meaning to like look directly at the camera and all like going like that, even though page is there. There's that like the actual camera screen's there and then the camera's there. It's like anyway. Head load. What causes anxiety? Anxiety disorders may be caused by environmental factors, medical factors, genetic brain chemistry, substance abuse, or a combination of these. It is most commonly triggered by the stress in our lives. Usually, anxiety is a response to outside forces, but it is possible that we make ourselves anxious with negative self-talk, a habit always telling ourselves the worst will happen. Environmental and external factors. Environmental factors that are known to cause several types of anxiety include trauma from events such as abuse, victimization, or the death of a loved one. Stress in a personal relationship, marriage, friendship, and divorce. Stress at work, stress from school, stress about finances and money, stress from a natural disaster, lack of oxygen in high altitude areas. Didn't think about that one. What else? Medical factors. Anxiety is associated with medical factors such as anemia, I think that's asthma, infections, I think that says that, anyway, infections and several heart conditions. Some medically related causes of anxiety include stress from a serious medical illness, side effects of medication, symptoms of a medical illness. Again, I hate the word illness. It just, anyway, I'm just going to ignore it for this one, I guess. Anyway, lack of oxygen from emphysema, or it's EMPHYSEMA. Emphysema or something, I don't know. Or pulmonary embolism. Basically, it says even in brackets, so I don't even know how to say that one. A blood clot in the lung. Okay. It's a bit nasty. Substance use and abuse. It is estimated that about half of patients who utilize mental health services for anxiety disorders such as GAD, panic disorder, or social phobia are doing so because of alcohol or benzodiazepine. Dependence. Yeah, forgot to read the next line. More generally, anxiety is also known to result from. Is also known. I think that's meant to say known. Known to result from intoxication from an illicit drug such as cocaine or amphetamines. I'm not sure if I said that right either. Withdrawal from an illicit drug such as heroin or from prescription drugs such as Vicodin, benzodiazepine or barbiturates, barbiturate rates. It might be rates even, but in that. I'm not sure if some of these words I'm saying right, if I'm not, to be honest. Sorry about that. Anyway, genetics. It's been suggested by some researchers that a family history of anxiety increases the likelihood of that a person will develop it. That is, some people may have a genetic predisposition that gives them a greater chance of suffering from anxiety disorders. And at least in my family, I can kind of agree to that. A lot of my family suffer from anxiety, which is a tad unlucky. Anyway, brain chemistry. Research even has shown that people with abnormal levels of certain neurotransmitters in the brain are, I love that word, in the brain are more likely to suffer from generalized anxiety likely to suffer from generalized anxiety disorder. When neurotransmitters are not working properly, the brain's internal communication network breaks down, and the brain may react in an inappropriate way in some situations. This can lead to anxiety. This one I actually don't know, and it's a rather good question. How is anxiety diagnosed? Anxiety. Oh, what am I doing? A psychiatrist, clinical psychologist, or other mental health professional is usually enlisted to diagnose anxiety and identify the causes of it. The physician will take a careful medical and personal history, perform a physical examination, and order laboratory tests as needed. There is no one laboratory test that can be used to diagnose anxiety, but tests may provide useful information about a medical condition that may be causing physical illness or other anxiety symptoms. To be diagnosed with general anxiety disorder, or GAD for short, a person must excessively worry and be anxious about several different events or activities on more days than not for at least 6 months. But at the same time, I guess that's a bit of a rough guideline, so I wouldn't, as soon as you hear that, I wouldn't start panicking. I guess especially if you do actually have anxiety, because then I'll shut up, don't worry, I'm probably not helping anyway. Whoops, sorry. Find it difficult to control the worry. That's another bullet point. Have at least 3 of the following 6 symptoms associated with the anxiety on more days than not in the last 6 months. Restlessness, fatigue, irritability, muscle tension, difficulty sleeping, difficulty concentration. And I find that when I get anxious, I will have muscle tension, which is the jaw, because I have a tick where I will chew my tongue. And because of it, the jaw muscle is stronger than I think it should be, and I think that's what causes it to, spasm. And I won't continue talking about it, to be honest, because I hate talking about it, if I'm honest. I don't know, so all the things I've got. Anyway, I'll continue before I bore. Yeah. Generally, to be diagnosed with GAD, symptoms must be present more often than not for 6 months, and they must interfere. Don't say why they must. Anyway, sorry. I'm so sorry. Sorry. Yeah. I've lost myself. Symptoms must be present for more often than not for 6 months, and they must interfere with daily living, causing the sufferer to miss work or school. If the focus of the anxiety and worry is confined to a particular anxiety disorder, GAD will not be the diagnosis. For example, a physician may diagnose panic disorder if the anxiety is focused on worrying about having a panic attack, social phobia if worrying about being embarrassed in public, separation anxiety disorder if worrying about being away from home or relatives, anorexia, which they actually never gave any little description thing on. Anorexia nervosa if worrying about gaining weight, or another one they didn't really describe, hypochondriasis, which is basically a hypochondriac is easy to see, I guess. Basically, it's worrying about thinking there's, in a way, from what I know, is always worrying that you've got some sort of either, like they say, illness, like sort of got basically something wrong with you. Probably not the best word to use, but sort of worrying that something's not right is probably a better way. Right? So I don't know. I won't explain about it 'cause I don't really know enough to explain, if that makes sense, without, you know what I mean. Patients with anxiety disorder often present symptoms similar to clinical depression and vice versa. It is rare for a patient to exhibit symptoms of only one of these. And the symptoms of anxiety. The site is really good. Guys, I've been talking 20 minutes. The last one is treatments for anxiety after the next page based, and I won't do that one because, no, different people find different ways and agree to different ways, so I find the best way is to just learn your own way, if that makes sense. What are the common symptoms of anxiety? People with anxiety disorders present a variety of physical symptoms in addition to non-physical symptoms. I felt like I needed a bourbon, but I didn't. Non-physical symptoms that characterize the disorders, such as excessive unrealistic worrying. Many of these symptoms are similar to those exhibited by a person suffering general illness, heart attack or stroke, and this tends to further increase anxiety. The following is a list of physical symptoms associated with GAD, which is generalized anxiety disorder, if I remember correctly. Trembling, churning stomach, nausea, diarrhea, headache, backache, heart palpitations, where I believe that's where, like, you know, where like the heart usually goes like, oh, I can't remember, like basically boom 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 boom. It'll be like boom 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 boom. Like really, I think that's what it is. You know, I won't quote me on that. Numbness or pins and needles in arms, hands, or legs. Sweating or flushing, like hot flushes or cold flushes, I guess. That's like where you get just really hot, like really quickly. It could be, I don't know. Again, I won't really go into it because although I'll get them, I don't know too much about it. Restlessness, easily tired, trouble concentrating, irritability, muscle tension, frequent urination, trouble falling or staying asleep. That's like trouble falling asleep or staying asleep. Being easily startled, like a bit jumpy. Those suffering from panic disorders may experience similar physical symptoms to those with GAD. They also may experience chest pain, a sense of choking, shortness of breath, and dizziness. Post-traumatic stress disorders may have a range of symptoms that are unique to this form of anxiety. Frequent symptomatic behaviors include flashback or nightmares of re-experiencing the trauma, avoidance of people, places, and things that are associated with the original event, difficulty concentrating or sleeping, closely watching surroundings even, hypervigilance, that's what it means, irritability and diminished feelings or aspirations for the future. Again, they put another video of that, and yeah, that was that for that page. So, like I said, I won't go on the treatment for anxiety. I don't think, because, well, I don't know. Sort of comment, like, I can always do it on a different video, but I will end this one here. Hope you enjoyed. Hope you found it informative. I will be doing another one at some point, like sort of about confidence, like how to display confidence, and I guess in a way why I think anxiety or confidence can be linked to anxiety, as it kind of slightly self-explains. Yeah, so I will possibly give my own little experiences on that as well. Thank you for listening. Until next time, I will be doing the next video about, after this one, I guess. Yeah, tally ho. Until next time, what? That's back, I know. Anyway, yeah, until next time. This has been In the Mind of Me. What is anxiety? Goodbye.